Hi, Dr. Bird showing trigger point therapy for the hip flexors and the diaphragm. So here's an interesting thing. The diaphragm is the primary muscle of respiration. It attaches underneath and inside the rib cage on the lower thoracic vertebra and the thoracic ribs all the way around to the spine and the top 3 lumbar vertebrae. So we get very interesting results by doing trigger points here that help the hip flexors right in through here, which also attach in the same zone as the diaphragm. So it is a core stabilizing muscle as well. It's the primary muscle of respiration, and freeing this up can also help with low back issues, problems into your mid back and into the shoulder blade. So this one's a little different than prior trigger point videos. We go in and feel, we're going to take our hand right in by the ribs, slowly press in until the person says, right there, feel it? Very light pressure. And you're going to hold it maybe 5, 10, 20 seconds as it releases, but make sure they're breathing. And she'll tell you right there, it feels like we let up. Would you agree? Then we slowly press in until a little deeper, until right there again, feels tender. Not very comfortable area to work on. I wouldn't recommend doing it on a full stomach, or if somebody's had recent procedures, things like that, or has some kind of condition in here, then get an okay first before you do this from like other providers, or have us check them. And feel that releasing. And you go in a little deeper, breathe in, and there it let go. Did you feel that release into your spine as well, or just where my hand's at?
Just release.
Some people will feel it release in the back as well. So we get that to release. Very often the hip flexors, drop the slide please. The hip flexors right in here will also release because of that synergistic mechanism of the muscles working in combination. So I'd recommend checking this one first. Then on the hip flexor, I'd have both knees bent. We're going to keep this one down so you can see it easier. You go right in on the inside of the pelvis right here. We're going to reach in and grab the hip flexor. So we work in this, slowly put pressure down and in, squeezing in like so, until she says, okay. Breathe, and there, released. You can also take this, once it releases, strip out the muscle, straighten the leg back and forth, have the patient just run their leg down and come back, and then take it out and in, have them activate that, and it really opens that up. So see if that helps you with your back and rib cage problems, and maybe even some other issues going on with the diaphragm.